Hi, my name is Dupe Diyaolu, and I will be presenting our work titled High RAS Expression is Associated with Poor Neuroblastoma Patient Survival and Required for Tumor Formation in an Orthotopic Mouse Model. Neuroblastoma is the most common pediatric extracranial malignancy, resulting in hundreds of new cases yearly. Treatment requires a multimodal approach, and remission can be especially difficult with high-risk features or poor prognostic indicators. Research is typically focused on MYC amplification. However, this accounts for approximately 22% of tumors. The RAS-MAPK pathway has been recently found to contribute to neuroblastoma formation. Specifically, there's evidence that mutations in RAS genes, NRAS, HRAS, and KRAS lead to activation of this pathway and establishment of neuroblastoma. Because of these findings in human tumor cells, we hypothesize that high RAS expression results in poor patient survival and RAS inhibition delays tumor formation. In order to test this hypothesis, we developed a RAS monobody, NS1, that inhibits HRAS and KRAS mediated signaling by binding the allosteric lobe and preventing self-association and clustering, preventing RAS activation of downstream effectors. Using the GSE 62564 dataset of 498 patients, we identified subpopulations in neuroblastoma, which were MYC non-amplified, have MYC low expression, and have HRAS expression. We also staply affected a cell line, SKNFI, with a lentivirus encoded with doxycycline-regulated NS1 expression construct that allowed for chemically regulated NS1 expression and RAS inhibition called SKNFI-NS1. These cells were treated with dox or no dox to determine the effects of RAS inhibition on cell proliferation and ERK-MAPK activity by Western blot analysis for PERK levels. We then created an orthotopic neuroblastoma xenograft by injecting SKNFI cells into the left adrenal gland of immunocompromised mice. Mice received fresh water with or without doxycycline every other day for 2 months, and the tumors were tracked with ultrasound. When comparing patients with MYC non-amplified, MYC low-expressed neuroblastoma who had HRAS high expression to HRAS low, those with HRAS high expression had a statistically significant poorer overall survival. In the Western blot on the left, the bottom 2 panels demonstrate total RAS input and NS1 expression in the cell lysate. NS1 expression decreased RAS GTP levels. The top panel demonstrates inhibition of RAS after exposure to doxycycline. In the next Western blot, the middle panel is the expression of ERK in the cell lysate. Phosphorylation of ERK requires RAS activation. The bottom panel confirms NS1 expression, and the top panel confirms that in the presence of doxycycline, NS1 inhibited phospho-ERK levels in SKNFI cells. In terms of cell proliferation, we saw that cells that were treated with dox had a significantly decreased proliferation compared to cells that had no exposure to dox. This graph demonstrates evidence of neuroblastoma tumors after cells were injected into the adrenal gland. Mice who did not receive dox water with no induction of NS1, therefore no RAS inhibition, began to develop tumors at 13 days post-injection, while those who did receive dox water developed tumors on day 30. By post-cell injection day 34, all non-dox treated animals had developed tumors, while only 60% of dox treated animals had evidence of tumor. Some limitations of this project were that although SKNFI cells fit the particular patient characteristics that we're studying, this is only one cell line, and there are other cell lines which need to be examined in order to see the effects of RAS expression. In addition, utilizing a monobody in the clinical setting is challenging and will require further development. In conclusion, NS1 can be used to help determine the role of RAS in neuroblastoma tumorigenesis by inhibiting HRAS and KRAS to decrease RAS activity. Inhibition of RAS delays tumor formation suggesting that RAS-MAPK pathway can be used as a target for therapy. Patients with high RAS expression have poor overall survival. In the future, we aim to evaluate cell lines similar to SKNFI with high RAS expression to see if they behave similarly. We also hope to determine if RAS-MAPK pathway inhibition also leads to decreased neuroblastoma recurrence. Finally, we aim to study downstream molecular targets in the RAS-MAPK pathway to see how DOX induction can suppress the RAS pathway. Thank you.